Hi guys, Oscar here with Gastroenterology Simplified. I'm a board-certified physician assistant, and today we are going to be talking about ischemic colitis. Before we go any further, I want you to understand that this video is for educational purposes only. If you have any questions, concerns, or symptoms, always consult with your primary care physician or your physician assistant. What is ischemic colitis? Ischemic colitis is a condition where the blood flow to part of the colon, large intestine, becomes reduced, leading to inflammation and injury of the intestinal wall. It is the most common form of intestinal ischemia. What is the pathophysiology? The colon requires continuous blood flow from branches of the superior and inferior mesenteric arteries. When blood flow drops, due to a blockage or low perfusion, hence hypotension, just to name a few, the mucosa becomes hypoxic, causing mucosal inflammation, ulceration, bleeding, and in severe cases, full thickness necrosis. The most common area that is at risk is the splenic flexure and the rectal sigmoid junction. The splenic flexure is where the transverse colon makes that turn to the descending colon. That area is the splenic flexure, and the rectal sigmoid area is the descending colon making a turn at the sigmoid colon. What are some of the causes? Ischemic colitis usually results from a temporary hypoperfusion rather than a complete arterial blockage. And the frequent causes includes hypotension, dehydration, shock, heart failure, atherosclerosis, medications, vasoconstrictors, estrogen therapy, hypercoagulable state, and post-surgical states, especially after aortic surgery. Now, what are the symptoms? How is the patient going to present? Well, the typical presentation includes sudden abdominal pain. I'm going to give you this sample real quick. A 86-year-old female with a history of COPD, congestive heart failure, coronary arterial disease, previous smoker, is having dinner with her family. And right after having dinner, she suddenly has this severe abdominal pain on the left lower quadrant area of her abdomen, and her blood pressure drops suddenly. That is a typical ischemic colitis, presentation of ischemic colitis. So, once again, the typical presentation includes sudden abdominal pain, often on the left side, urgency to defecate, bloody diarrhea or hematochezia, which is just blood per rectum, mild abdominal tenderness. Pain usually precedes bleeding by several hours. Now the patient presented to the hospital or to the clinic. How are you going to diagnose all this? Well, the key diagnosis here is a CT scan with contrast. And what I would obtain would be a CT angio of the abdomen and pelvis. Now, the CT scan is going to show segmental colonic wall thickening and mucosal edema. If you want a very sensitive test, then you're going to proceed with a colonoscopy, which is going to show a pale or bluish mucosa, linear ulcers, and the mucosa is likely going to show ischemia or confirm the ischemia. So now you have the presentation, how are you going to diagnose it, and how are you going to treat the patient? Well, the management depends on the severity. Mild to moderate cases, you're going to give IV fluids, bowel rest, so NPO, nothing by mouth, broad spectrum antibiotics, avoid vasoconstrictive drugs. Most patients improve within 48 to 72 hours. In severe cases, the patient may require surgery if there is evidence or signs of peritonitis, gangrene, persistent bleeding, or colonic perforation, which is an emergency. About 15 to 20% of the patient may require surgery eventually. How is the prognosis? Majority recover completely with conservative management, which includes the IV fluids, broad spectrum antibiotics, and nothing by mouth, which is NPO. Mortality is low in mild disease, but mortality increases significantly with gangrene or right-sided ischemia. If you found this video helpful, don't forget to follow Gastroenterology Simplified for simple and clear medical education. I will see you in the next one. Have a good one. Bye.